We're experiencing pandemics at an increasing frequency. So rather than 50 to 100 years between pandemics, we're seeing 10, 15 or less. For example, with coronaviruses, we've seen 3 major disease outbreaks due to coronaviruses in just the last 2 decades.
COVID has showed us that we really need to be proactive in our efforts to survey biodiversity and host taxa that may harbor viruses that may be of interest, as well as providing those specimens for a whole host of other questions that are related to the pandemic, climate change, the biodiversity loss. There's a whole suite of issues that are occurring at a global scale that museum collections can and should, and at some level are involved with already.
Human health is dependent on the environmental health and the health of animals, whether that's domestic animals or wildlife species. And when we ignore one of those aspects, there are ripple consequences.
Our paper really is a call to the research community, in particular, those of us that are in the natural history collection world and biodiversity science, and others that are engaged in public health related research, to come together to find ways that allow for this sort of holistic approach to pandemic prevention that bring an expertise that's currently missing. Vouchering is the process of archiving a physical specimen, an animal that was collected in the field, or archiving the tissue samples or blood that's been subsampled from that animal.
We're that initial step. We go out and we collect information about the host specimens. We can't prevent a pandemic if we don't know what pathogen could be the cause of that next pandemic.